Hello, everyone, and welcome to today's event. I am Steve Myers, Managing Editor with Digital Health Insights, and we welcome you to today's fireside chat, as we call it. It's like a panel discussion. Um, Wellness first, how early diagnostics and connected technology can shape the future of healthcare. Before we get started, a few quick notes. This session is being recorded and will be available on demand. So don't worry there. You can access it at your convenience if you miss part of it. And for those who, for some reason, weren't able to attend, everyone will have access to this and you'll get to hear it all. Today's format is, as I mentioned, we call it a fireside chat. It's a moderated panel. We have until the top of the hour, so we'll leave some time for some Q&A at the end of the chat. If you would please submit some questions at any time, you'll see a Q&A function, a little window there on your screen here in Zoom. Feel free at any time to put a question in there, and fear not, any questions that we don't get to, we will forward those to the speakers. Now, you didn't come here to hear from me. We have the perfect panelists to talk to you about this topic today, and I'll tell you why. Rahul Mehendale is a managing director in the life sciences and healthcare practice at Deloitte Consulting, where he strengthens the strategy and analytics offerings they have. He has extensive experience with entrepreneurship, disruptive innovation, and healthcare, especially how these intersect with each other. Overall, he helped shape Deloitte's impact on the future of health-inspired landscape. And prior to joining Deloitte, Rahul founded and ran MySkin for 12 years, helping to create a $50 billion global quantified skin category with a first-of-its-kind skincare analytics and imaging platform. Also with us today is Joshua Stein, Chief Growth Officer at Fitbit Health Solutions, now part of Google. The mission at Fitbit is to help everyone in the world become healthier and to empower individuals with information and resources to live their healthiest life. Josh oversees sales, business development, account management, and implementation functions. Prior to joining Fitbit, he held leadership positions at Progeny and WebMD Health Services, where he helped drive double-digit growth. So we're in excellent hands, and I can't wait to hear what these guys have to tell us about this incredible topic that's very timely. So if you're ready, fellas, let's jump right in. I think it's great to start our conversation on how early diagnostics will shape the future of health. So whoever wants to jump in, give us a little insights onto what you think about early diagnostics and the future of health.
Sure, and maybe I can kick it off. First of all, thanks, Steve. Josh, great to be doing this with you. And for all the members, thank you for joining and looking forward to a really engaging session. That's a really good question from a standpoint of shaping the future of health. So the early diagnostics, in our opinion, are going to lead to shifting of acute sick care and treatment more into prevention and wellness. So diagnostics are going to enable that. I mean, our view from a Deloitte perspective has been that today's healthcare spend is primarily sick care oriented. So, we see 80% of all the healthcare spend basically on 20% of the patients, which happens in their last few years of life. As we look forward, as we look forward 5, 10, until 2040, we actually feel that the entire pie of spend around healthcare, which today is primarily sick care oriented, we feel almost 60+% of that spend by 2040 is going to be around prevention, wellness, and other well-care related products and services. So I just want us to pause for a minute and think. So all these opportunities, whether it's around Peloton, whether it's around Deloitte, whether it's around diet apps, whether it's Fitbit, all these aspects of products and services that we consume while we are still well, this is where the growth is going to be. Because almost 60% of that entire spend by 2040 is going to be along these diagnostic components, which we would be consuming while we are still well. So on that front, again, we are seeing this trend towards proactive diagnostics or proactive, wellness oriented monitoring of existing diseases, monitoring of my health so that I can maintain 100% health component. But we are definitely seeing this early detection driving this growth, and driving it through home collection kits, wearable sensors, various always on technologies. Basically, that will help consumers understand what is happening inside their bodies and understand what's happening inside their bodies before the disease progresses. And of course, the implications where now those early diagnostics in that future of health world would drive less costly recommendations, less expensive interventions, less expensive treatments, so on and so forth. So broadly, that's how we see diagnostics shaping the future of health.
Yeah, and I couldn't agree more. And first and foremost, Steve, thank you so much for the introduction and having me here today. Excited to be here with all of you and to chat with my friend and colleague, Rahul. For additional background and context, I work within the enterprise arm within Fitbit. We work with employers, health plans, health systems, research entities to drive behavior change within their populations and to improve healthcare outcomes. As Steve noted, we were acquired by Google several years ago, and we're part of a global effort to improve the health of billions. At a macro level, I think it's important to provide a little bit more context. At a macro level, there's just been exponential growth of healthcare data. Healthcare data accounts for about 30% of the world's data. The number of connected wearable devices worldwide is forecasted to reach more than 1 billion devices. And then within Google, across the organization, we're catalyzing the use of data through research and development to improve screening and diagnosis of disease and to optimize patient care. We're doing a lot of work within the research front. Fitbit is a wearable choice within clinical research. We have over 1,500 published studies. And to provide just a couple of examples to expand upon some of the things that Rahul noted, I think it'd be helpful to just give a little bit of context around some of the research initiatives that we're pursuing. One was at the onset of COVID. We collaborated with Stanford and Scripps to assess the extent to which wearable devices can detect COVID among asymptomatic and pre-symptomatic individuals. One of the big issues with the pandemic are related to the fact that individuals are highly contagious and didn't know that they were sick. And we saw a strong correlation between a couple of key biomarkers that we were capturing from wearable devices, in particular, decreases in heart rate variability, increases in resting heart rate, and increases in respiration rate to correlate who had COVID. There was another study published in Lancet to evaluate population trends of seasonality of respiratory infections like the flu. And we saw a strong correlation. They saw a strong correlation at a population health level across 5 states of key biomarkers, in particular, sleep data and resting heart rate, on the prediction of flu-like illnesses within those population segments. And then beyond that, wearables are also being leveraged to support proactive and preventative care. There are a number of studies, one in particular that was recently published looking at a cohort of cancer patients evaluating physical activity pre and post-op. And there was a correlation between physical activity during inpatient recovery and the risk of readmission rates. And then lastly, we could touch upon a little later, we recently published information regarding our heart health study, where within a 5-month time frame, there were over 455,000 participants. And we used that data to assess the ability to detect atrial fibrillation, which ultimately led to the FDA approval of our PPG algorithm. So at the end of the day, consumers, there's a tremendous amount of information. Consumers are empowered with more information and proactive, timely information than they've had before. And then the question is, how does that information become meaningful and actionable, not only to consumers, but also to caregivers and the community at large?
Maybe Josh, just to jump in, I really like what you said about this. You are empowering consumers. I think from a diagnostics shaping the future of health perspective, I think that is spot on, because we know that consumers are increasingly engaging in their health with digital, and more importantly, we also think that it changes their behavior. So we just wrapped up recently, actually last month, fresh off the press, a Deloitte survey of healthcare consumers, and we were quite surprised to see some of the results. So for example, I think we saw about 49% of the consumers using devices to measure fitness, health improvements in 2022, 49%. And this is up from 28% in 2015. So that's a substantial growth. As you talked about empowered consumer, there's a substantial growth that we are seeing. We are seeing 1 in 3, that's almost 34%, using devices to monitor health issues. Again, these are health issues like blood pressure, blood sugar, breathing function, mood, activity, so on and so forth, sleep. I mean, you covered a whole series of other things. But very interestingly, as you pointed out around changing behaviors, one of the sets of data that really floored me was seeing that almost 80% thought that using these devices helped them change their health behaviors. So I just wanted to re-emphasize, attach some of the consumer survey data that we had picked up, that I thought, on your theme of empowered consumer and consumers using these elements to change behaviors. I thought that was pretty spot on.
Yeah, especially as you look at overarching trends, as you noted, in terms of transitioning from sick care to well care, which we're seeing across the health plans and health systems that we're working with. Within our portfolio, we support key and address key modifiable risk factors like stress, sleep, exercise, nutrition. Of course, there's a layer, an analytics layer on top of that, as I noted before, to support illness detection and to empower individuals with the information that they need. And lastly, when you look at the correlation between, there was a recent study that was published through All of Us, and I could share all the research materials following this discussion. There was a direct correlation between steps and the reduction of risk of diabetes by almost 25% at specific cohorts and the number of steps that were taken. And then it also evaluated the risk mitigation across other chronic conditions and risks such as obesity, hypertension, and the like. So there's definitely more of a shift in focus from a consumer-centric lens. And then the question is, how does that tie into the care delivery system as a whole?
Well, I think that's some really great insights, and especially from the consumer behavior. And I mean, if we think about the people who do go get an annual checkup, and then you get your tests run and you get those results, and you might change your behavior, but then maybe just like a New Year's resolution, the dedication to that change sort of can fade over time. And with a device consistently or regularly keeping you on track, perhaps I can see where the dedication would be a little more consistent. And so on that note, you mentioned some of the devices, and obviously we have, Fitbit here, thankfully for us, in the discussion. But let's talk a little bit more about the devices and the technologies that you think could have the most impact on this idea of early detection. So if you could give us a little more insight on what technologies you foresee having the most impact, I think that would be a great next step in the discussion.
Yeah, I mean, and I can jump in again. I think the investment community definitely understands the importance of diagnostics, and it's really pouring money into the sector at record levels. So just to put it, the VC deal size in perspective, we saw the average VC deal size spike. So it almost doubled, or it did double, just between 2019 to 2021. So it went from 14 million in 2019 to 28 million in 2021. So there is absolutely an understanding that diagnostics and particular technologies are going to have a dramatic impact on early detection. Some specific areas, which we think are very innovative, where investments are being driven. I mean, Josh already talked about or laid out some of the elements around sleep, stress, activity, diet, variables that get into that space. We are definitely seeing rapid point of care or at-home diagnostics, specifically for infectious diseases. Of course, that's also being seen and driven or greatly motivated by the current crisis around COVID. We are definitely seeing investments around and interest around miniaturized sensors, wearables that enable non-invasive continuous monitoring of conditions like hypertension, blood glucose, so on and so forth. So there's sensors and wearables is definitely an area of interest. We are seeing portable technologies which enable imaging. So anything that moves this outside of the acute care setting. So being able to do imaging, let's say at home or in a retail location, you walk into a Walmart, so on and so forth. Those sort of portable technologies seem to be attracting a lot of attention. We are absolutely seeing interest around simple, non-invasive biomarker tests. Again, all sorts of different biomarkers that are being collected for various disease states, also biomarkers for everything from metabolism to sleep to other pieces. And then lastly, we are definitely seeing technologies and investment interest around AI-assisted insights. So how do we layer AI-assisted insights into technologies, whether it's to improve adherence, whether it's to improve efficacy, whether it's to improve productivity, and potentially how do these AI assisted insight tools do holistic management. So for example, it's not just about telling me that I'm walking less or more, but if I do walk very intensely, how could that potentially impact my diet? How could my diet, what I ate yesterday, how should that impact what time I go to sleep and when I wake up, so on and so forth. So I think having the ability for AI to generate insight into technologies and tools which are fairly holistic, that's another area where we see there's going to be a huge impact in terms of early detection.
Yeah, no, I couldn't agree more. My response, I guess, will have two parts to it. One is more of a consumer wearable, Fitbit-centric view of the world, and then a macro view, just looking at artificial intelligence and how we could leverage the data to serve as a catalyst to drive health equity and essentially democratization of healthcare on a global basis. When you look at consumer wearables, which individuals are wearing due to intrinsic motivation, it's having a subset of impact as you're engaging individuals in their everyday moments. When you look at broad-based market trends as it relates to consumer wearables, the sensors available on the devices have significantly expanded over the past couple of years. I referenced the ECG app, which helps detect high and low heart rate notifications and AFib detection, EVA sensors to support, which is an electronic dermal activity sensor to measure stress levels, and our newest device has a continuous EVA sensor, skin temperature, SpO2. And so the sensors and the information available on the devices are significantly expanding. And then what we're seeing is a trend from these enhanced sensors and capabilities on our smartwatch category moving into trackers. Is when, if you look at our goal and objective to improve the health of billions of individuals around the world, affordability and accessibility is a key area of focus and part and parcel to some of those developments. Rahul referenced sleep, not only looking at sleep quantity, but sleep quality as well. And a lot of the biomarkers that we're capturing is a result of extended battery life, which is another trend that we're seeing, where you're able to pick up key biomarkers while individuals are sleeping. And that ties into some of the things that I referenced around the COVID research that we conducted. If you look at the sensor technology and just looking at AFib in particular, there are 33 million individuals on a global basis that have AFib, and individuals with AFib have 5 times higher risk of a stroke. When you look looking at it at a broader view and just the impact of AI, there's extensive work across other segments of Google, where we launched, just an example of that, we launched an initiative in India to help detect diabetic retinopathy. It was software as a medical device that was used to help screen patients with diabetes. In India, where the prevalence rate for diabetes is 18%. And there's a shortage of specialists to screen patients. So when you look at the impact of that from a screening perspective, and the fact that there are over 420 million people globally that have diabetes, it's just a massive opportunity to provide meaningful and actionable information to individuals and their caregivers.
I think, Josh, I mean, you're bringing up some great points, and I noticed, there were a couple of questions that came in too. Jennifer Tucker and Kurt Hildebrand also brought up, an important topic which you actually hit on right up front, right, which is around reducing health disparities, equity. How wearables could actually help address some of these challenges. And I think those questions are spot on. I think right now our wearables as we traditionally may be thinking about them, are they expensive? Yes, they are. And I think the goal, just like hopefully like mobile phones, the goal would be to get them out to everybody. Because I think one of the things we are also realizing is that these early interventions are hugely cost beneficial. So it may seem like it's expensive right now, but our assessment is that over time, as you start leveraging these insights, whether it's around, I think, as you said, sleep, diabetes, retinopathy, diabetic retinopathies, so on and so forth, the implication of letting a disease progress to a critical stage results in huge costs. And it's much easier to detect early. So again, Josh knows I'm a Fitbit fan. So, I mean, literally last week, I had a real situation in my home, right? My wife, her heart rate, she probably got POTS, post-COVID, where her heart rate has suddenly skyrocketed by about 20%. And without, our option would have been to go get a holster, which costs, $5,000-$10,000, right? But here she has her Fitbit, and we were very quickly able to go in and see how her heart rate was, what has been happening in real time, so on and so forth, to determine that her heart rate actually jumped up 20%. And then we had a whole series. I'm a device nut, so I have literally all devices, whether it's my sleep app, my Fitbit, my posture control device. I mean, all these things. I have a BP cuff, all these things. So I was able to then run a report and then share it with the physician, like a virtual health, intervention. And sitting at home, we were able to do these things where, again, from an equity perspective, these are the sort of tools which actually reduce cost and make and drive more access, drive more benefits to the average population. I think over time, we absolutely want to be able to skate down to creating an impact to as many people as possible, right? And Josh, I think you talked about the India experiment that you were running, and there you go. I mean, that's not a very affluent market to start off with. So, kudos to you and your team for doing this. But I think the intent would be not just capturing data, but also learning and developing experiences which dramatically address these issues around equity, which make diagnostics real in the future of health.
Well, if you think about it, it's a really good point. At one time, astronauts were probably the only ones taking advantage of, or having the privilege of having this kind of wearable and monitoring, and this personalized monitoring. And now, based on what you guys are saying and what we see, it is really a possibility for this to be available to a bigger population. And so the sort of disparity there, the equity is one barrier, but I want to interject and hear from you guys on some of the other barriers, not obviously the equity barrier and populations, but about the processes and technology, suggesting some of the interoperability. Can we discuss some of those barriers and solutions that are at play here?
Josh, I've been going first, so I'll let you go first this time.
Thanks, Rahul. Yeah, I mean, there are definitely a number of barriers at play, and I think we touched upon some of them. Process flows being a large one. So there are disparate data systems and disparate workflows that prevent providers from having a longitudinal view of the patient. And so that's one barrier. Rahul touched upon this with respect to misaligned incentives, at least in the US, as it relates to traditional sick care versus and incentives that are focused on compliance and utilization versus reversal per se. And then health equity, and that ties into a number of different facets. Health literacy, access to care, affordability and accessibility, even health research. If you look at the health research, where, as I noted before, we're actively involved in a number of different initiatives, the health research historically has tended to skew to white and females. And so when you look at health equity and research, it's really important to take a look at multiple and all population segments, especially when you look at disparities across the healthcare delivery system. And there's extensive work going on within Google and, of course, within other organizations to address some of those areas. So one is an example of that is with respect to the work within Google Cloud and with other areas of the business where there's extensive work and effort to digitize patient data in a secure, standardized format to support interoperability of data across different systems and to harmonize data across different systems to provide that real-time interoperable layer from a longitudinal perspective. There's a lot more work to be done there, but there's exciting developments in that regard. Where wearable data is also being mixed into that as well. We talked about consumer empowerment, and that ties into not only the key modifiable risk factors and providing information on the sensors on wrist, but also integrating first-party and third-party devices and data as well. So a good example of that is integrating data from glucometers to give individuals a better understanding of the correlation between stress and sleep and glucose values. And I saw there was a question in the chat with regards to well-being report, with regards to the extent to which we share information or individuals and consumers share information with providers. There is a well-being report and wellness report that individuals can share. Rahul touched upon a personal experience. I had a personal experience as well. I did receive a notification, an AFib notification, and I went, to the doctor and showed my health metrics dashboard and my well-being report, and ultimately led to an appointment with a cardiologist. Everything's fine, but it's just an illustration of some of the ways in which that data is being leveraged and utilized from a consumer as well as provider engagement perspective. And then information is a determinant of health as well. And obviously, everyone's familiar with Google in terms of delivering high quality, actionable information in a timely manner. Individuals are going to Google with health related questions. I believe, I have to check the source material, but I believe hundreds of millions of times a day. And then we have authoritative content on YouTube. And during COVID, that's a great example of that, where our COVID-19 information panels served over 500 billion impressions. And so that's a massive effort. So when you look at health literacy as a determinant of health, that's a key area of focus for us as a business. And then lastly, health equity research. We funded and awarded grants to researchers to support research projects, including studies to improve postpartum care for rural Black women and exploring health disparities in maternal care and fetal care for Black and Hispanic patients as well. Rahul and the Deloitte team have extensive information on the underlying drivers of cost to the healthcare delivery system and the impact from a human perspective as it relates to disparities in healthcare. And that's a key area of focus for us as well. And so lastly, it's there are a number of challenges. Fortunately, we've recognized those challenges and are actively addressing them, but it will absolutely take a cross-functional approach. Not only from a technology perspective and from a systems perspective, but from a regulatory one as well. So sorry for the long-winded response there, but Rahul, please fill in the gaps.
No, I could only build on. I think we would be in vehement agreement in terms of some of those barriers that you mentioned, uh, and I'm thinking about it from a perspective of what really is happening, right? I mean, we already covered, how diagnostics could shape and variables, and we already covered some of this stuff. But if we look at what is really, just to step back and before we get into the drivers, I mean, I'm just thinking there's an explosion of data and analytics. And Josh, you mentioned consumers are doing, hundreds of millions are coming in and doing their health questions answered on Google, right? But that's the second thing, which is, consumers are no longer being led by doctors. They're walking in empowered. They walk in, I think we did a survey where almost 80% of all consumers pre-diagnose themselves before they walk into a doctor's office. So it's not like they come in and they just give their symptom. They say, it's not like my stomach's always aching. It's about, doctor, my stomach's aching, and I feel like I have fevers and diarrhea, and I think I have Crohn's disease. And I'm sure people on this call have gone through that part. So the consumer, as you pointed out, is increasingly empowered. And one of the things that I'm seeing is the system is definitely moving from a provider centric to a more equitable consumer centric focus, right? There's a deconstruction that's happening where the physician was in the center of this health ecosystem, and now the patient or the consumer is in the center of this ecosystem. And whether we look at health records, we look at patient data, we look at in-office visits, we look at diagnostic tools. Everything used to be structured around the physician. And now we are seeing this reconstruction that's happening where everything is now moving towards being constructed around the consumer, around consumer centricity, in this new ecosystem, right? Or this new system. And so broadly, as I think about this reconstruction, and being a consultant, I'll probably come up with three things, right? So my top three barriers, I feel, are regulatory and reimbursement, number one. Second is around difficulties integrating with workflows, clinical workflows. And third, Josh, as you pointed out, was around consumer literacy or consumer education. So I think we already know the regulatory challenges. I think greater scrutiny as we start getting into more health specific insights, reimbursement. Again, that's a major component, because I think the wearable manufacturers and that entire ecosystem is trying to figure out, can the existing payer network reimburse them, right? So is there an ability to extract value while giving value to the consumer? So I think there's definitely a component there. Integration into these clinical workflows. Again, right now, this whole space is in that flux. As I pointed out, there's this reconstruction that's happening where the physician was at the center of this ecosystem, and now it's the consumer. So as this reconstruction is happening, the clinical workflows are changing. So how do we integrate into this fluid environment? And then lastly, around consumer education, right? So whether it's through apps, whether it's through nudges, you heard our personal stories. How do we continue to educate the consumer? And then specifically on that last part, as we have been surveying consumers' trust and willingness to share this sort of data, and the physicians' willingness to use this data, we've seen that 55% of consumers are sharing their data with their physicians. That's exactly what I did, right? For my wife, we took her Fitbit report and I shot it off to a physician. However, what's really interesting is only 4% of physicians are actually using patient data in their medical care. Surprising, very, very surprising. And I feel like this is, at some point, as more and more FDA approved metrics start coming in, devices start coming in, Fitbit, for example, when it's FDA approved and I send it to a physician. Now, if the physician doesn't look at it, this could create all sorts of legal implications. So my point is, as there are these barriers around technology and wearables and things of that nature, I don't think it's an option for traditional sick care oriented players to now start thinking about how to adopt these sets of data, these devices, this collection that's happening outside of the hospital environment, to generate insights and add value to the consumer. So I think that's what's happening from a consumer and physician perspective. And we see the same willingness to share data around tracked health information. So consumers are continue to be more willing to share this data, not just with doctors, but also with developers. And I don't know if you can talk about Fitbit, but what we are seeing that about 1 in 3 are willing to share their data with device developers to help improve the device. That's a lot of people. I mean, starting off, while this market is still nascent. And what it says is that consumers are really keen on the convenience, on the value that they're extracting or getting out of these different devices and wearables and other parts, that they're willing to share data with developers to improve the device and the experiences. So I think there are some barriers that are definitely in play, but we are also seeing consumers driving the addressing of these barriers or potential solutions.
Yeah, and just to piggyback on your last comment, the heart health study is a good illustration of that, where over 450,000 individuals opted in to the study within a 5-month time frame. And so when you look at the impact, not only of the power of a brand, a trusted brand, in collecting this information and how the data would be leveraged and utilized, and that individuals control the data, because everything that we do requires member consent in terms of the health management initiatives that we pursue. It is incredibly powerful.
And Josh, I was just looking at the chat too, and Daniel Novak, he made one of the participants. He just said that he told his cardiologist that 6 months, 6 devices confirmed his maximum heart rate at 105, and months and many dollars later, he said the doctor came back and said that your maximum heart rate is 105. There you go. I mean, these technologies, there are barriers, but these technologies, I think, can empower consumers like you and me and others on this call. So it's a great segue into these barriers and the cost implications.
Mm-hmm. And just looking at, I don't know if we want to cover all the Q&A now or at the end. So Steve, I'll defer to you. I saw a couple of questions in chat and in the Q&A section.
Well, before we get to the Q&A, there are certainly some questions coming in, and as we're well into the back 9 of the event right now, I encourage people to slip those questions in, start typing away. But while they're doing that, I did want to have the opportunity to sort of open up one last question from me, and before we get to the Q&A, and I want from each of you, we can start with Rahul, to give us an idea of what's the one, or what are the main things that you want people to take away from today's discussion? What are the most important bits?
So I think my top takeaway would actually be for all of us to understand that the consumer's mindset has changed. The consumer is taking control of their wellness journey because of the incentives focused on sick care within the traditional health ecosystem. The consumer is now consuming the Fitbits, the Pelotons, the diet apps, the sleep trackers. Even my car now tells me, all of our cars tells us if you're driving erratically, or, if I need to get rest. It's a health, in my car now I have a health mechanism or a checkup of some sort. So the consumer's mindset has changed. And despite the incentives being focused on sick care, the consumer is taking more and more control of their health and wellness. And this is no longer an option for the traditional players to consider whether we need to get in or not, or stay out on the periphery. This is going to only continue to accelerate and be increasingly adopted by the consumers, and they are going to drive a huge change, whether it's around prevention, whether it's around early diagnostics, whether it's around keeping me 100% fit, whether it's delaying my symptoms. The consumers are going to take control of this, and they're going to, and they're going to influence the reconstruction of this sick care oriented health ecosystem to focus on their needs. Josh.
I like the car metaphor, Rahul. I mean, if your engine light goes on in your car, you're going to take it in for service. From my perspective, we believe that technology can serve to reduce disparities in healthcare and democratize access to healthcare on a global basis. The mantra within the organization is that we build for everyone, and that's really our focal point. And it is exciting and rewarding to be part of a mission-driven organization that is truly committed to improving the health of billions of individuals. So the scale and the reach that we have enables us to deliver upon that mission. So that would be the one takeaway that I would have for the audience.
Very good. So now we can head to the questions. Now, Josh, I don't know if there was something, it almost sounded like you were ready to answer a question. So if there was one that you saw that you were poised to get into, by all means. Otherwise, we'll just go down the list.
Yeah, I saw one from, let me just pull it out here because I lost sight of it. But there was one related to, I think it was from James Wee, with regards to.
I have it here. It's what progress has been made in the industry on the self-reported readings, i.e. health rate, glucose readings, et cetera, interfacing seamlessly into the patient's medical records in EMR systems.
Now, it's an excellent question. Right now, the bulk of the work that we're doing within Fitbit has been with health plans, health systems, care management entities, where we have open APIs and they're integrating our data into their care management flows, whether it be health coaching or condition management programs or DPP programs. So we're currently, through our open APIs and with member consent, sharing data to support those types of care management initiatives. With regards to integrating data into EMR systems, it's a broader conversation, and it's one in which that aligns with some of the comments that I made earlier with regards to Google Cloud. It needs to be seamlessly integrated into care flows, especially when you look at productivity, administrative overhead, et cetera. It needs to be timely and actionable for caregivers. We recently conducted an analysis or survey through Medscape. The findings aren't ready to be released, but we could share that as a fast follow. Just looking at provider sentiment as it relates to consumer wearables and the extent to which they would leverage that information to support their care management efforts and to support patient care, in particular between provider visits. So more to come there. I'd say it's an area of opportunity and evolution for the business.
And maybe just to build on what you said, Josh, James, I think the EMR and the EHR or the PHR are going to merge. So the EMR is very, it's a snapshot view. It doesn't lead me into outcomes, right? So for example, if I got a knee replacement, it just tells me that I went to an orthopedic surgeon and tells me today's focus in the EMR tells me that it's a claims oriented focus, tells me I got a knee replacement. My Fitbit actually tracks better the outcome because it can tell if my stride length has increased. It can tell my pace. It can tell my balance. I mean, there are all these things that my Fitbit can tell me, which actually point to the outcome. So my sense is that the consumer is going to drive this push towards EMRs and PHRs, or personal health records, merging. And we are seeing governments actually start playing a role there. So actually, if you look at the Denmark system, the government of Denmark has now started driving this impetus to create a digital platform where these sets of data can be integrated. So wanted to share that.
On that behavior, that consumer behavior piece, as a big driver for this type of information, do you see growth in the wellness sector, not just the sick care physicians, but those encouraging behavior and mindset? And what careers should the younger generations consider to help propel this wellness healthcare sphere?
Yeah, maybe I can take this one. Absolutely. I mean, and I think that's what one of my key takeaways was, that just remember that by 2040, we expect almost a 700 plus CAGR in the wellness sector, and potentially a flat line on the spend in the sick care, on sick care products and services. So we are expecting 60% of the overall total healthcare spend to come from wellness by 2040. So that's where the growth is. We are seeing trends where physicians are actually getting into this space. So one of my friends is the chief hospital administrator at Mayo, and he the other day I was chatting with him, and he says Rahul, I'm signing up for a wellness, well-being, diet, nutrition, sleep oriented training. I was like, wow. So how did this happen? And he's like, all our physicians are being encouraged to do this. So not only is this our view on the market, but we have actually started seeing consumers take control on wellness and well-being, as well as the medical community now participating around wellness and well-being.
Yeah, and I would just say, just in terms of evolution and market trends, there are a number, Jennifer, in response to your question, I mean, there are a number of phenomenal point solution companies that are out there in the market to support mental health and other key risk factors and issues that individuals are addressing from a holistic well-being perspective. We're also seeing evolution within health plans as well. And if you look at trends and patterns, there's a pendulum switch between point solution entities or growth in point solution entities, and some of that being internalized within the health plans, but they achieve the same goals and objectives, and in many instances the same constituents as well, at least in the US, where they're focused on members as well as employer groups, and which are driving or serving as a catalyst for some of that change as well.
When you consider the opportunity era of wearables to help with diagnostics and monitoring and behavioral change, can you comment on any efforts that are being made on the provider side by providers to increase promotion and support of the use of these wearables?
It's a great question. I would say we're still at an early stage of that process. Rahul touched upon reimbursement as a key factor and lever. So that's one element of it. We're seeing growth and adoption of wearable devices, Fitbit included, being part of medical plan designs where it's an embedded benefit within a given health plan. And that's another way, maybe not through the provider lens, but just through the health insurance lens, because of the recognized value that it has on risk mitigation and population health improvement and cost reduction. And so there are a number of key variables that need to be addressed. We touched upon a couple of them during the course of this discussion: regulatory aspects, reimbursement, data integration, being able to prescribe a wearable device at point of care, being able to walk into a brick and mortar through an omni-channel experience, and to go to a pharma counter to receive not only medications but wearables in the future. I think there are a number of key factors and variables that need to be addressed in order for that to fully take shape. But we're seeing it in part, and there's definitely positive movement in that regard. Rahul, I know you've done extensive work analyzing the wearable space as a whole. Appreciate your subject matter expertise and perspective.
I think absolutely. I think thanks, Josh. So Steve, from your question in terms of providers starting to adopt and push wearables, there have started emerging certain use cases. So, for example, one that comes to my mind is around continuous glucose monitoring. So literally, we are seeing providers actually ask for other supplemental data in addition to their CGM readings. So they'll ask about diet. They'll ask, hey, send me the PDF of your cardia, send me a PDF of your activity, your Fitbit, activity report, and how you're sleeping. So it's very interesting to start seeing a certain set of providers now, agreeing to leverage wearable data and actually use that to drive customization and personalization for the patient or the consumer. So broadly, as Josh said, still nascent, still early, but we have definitely started seeing some trends where physicians do leverage some of this data, which is why when we did the survey, we saw only 4% of the physicians are actually leveraging the data. But a couple of years ago, that was zero. So that's what we're seeing.
Well, the talk about reimbursement makes me think about health and flex spending accounts. I wonder if anybody knows if these sorts of wearables are covered under that. I don't know. It'd be a good question. But you mentioned the percentage of physicians utilizing the data, and there was a question that came in, so I think it's a great time for it. When we look at the lower percentage of some physicians being willing to use the data, and they're not, do you think they consider the information reliable? Are they concerned about the reliability? Are they just not, you talked about the education piece of consumers, are they just not educated enough about these wearables and their accuracy?
No, I think I don't think there's just a single challenge in that space. So it's not just about whether they think that whether they think that the devices are not reliable, whether because there are apps, whether they're not trained or educated enough. So I think there are a myriad of different components. I think Josh also hit on reimbursement and insurance, right? So how do they actually get paid? There are regulatory components or pressures. If I look at this data, then do I, can I potentially be at the receiving end of a bad regulatory outcome or legal outcome? Or if I don't look at this data, will I be at the receiving end of a bad legal outcome? I think so. There are a myriad of confusing scenarios, as is very common in fast emerging spaces, right? I mean, we are seeing some of this even in the autonomous driving space. Ethical AI, so on and so forth. I mean, there are all these components where in a fast emerging space, these are traditionally experienced barriers, one may call them, or hesitations or challenges that need to be addressed. And so I don't think it's just device reliability. I don't think it's just education. I don't think it's just, how do I actually analyze so much of information, right? I mean, that also is one of the challenges. So it's not, I wouldn't call out any one particular piece as the key one, but regulatory and reimbursements, those two do drive a lot of behaviors within physicians.
Yeah, and just looking at some of the comments, like Ramona noted that both of physicians encourage the use of wearables, and it's being promoted through incentive and well-being programs. It's not so much a matter of, at least based on the data that we have, the reliability of the data. There's a tremendous amount of clinical research and rigor that goes into the products and solutions that we bring to market. And a great illustration of that is the FDA approval that we received for a PP algorithm for AFib detection, where there's 98% specificity from a predictive value perspective. So it isn't that isn't the primary driver. And I think there's a perceived recognition and the value that wearables bring with regards to behavior change. If you look at, for example, our active zone minutes, we'll look at vigorous exercise and CDC guidelines in terms of number of active minutes, moderate to vigorous, that individuals should have on a weekly basis. There is a direct correlation based on our data between active zone minutes and reduction in obesity levels, improvements in heart rate variability, resting heart rate, sleep, stress. And so I think, to a large extent, it's a matter of making it a systematic component that's standardized in the delivery of care, and that's going to take time. But Rahul, said it best, which is there's been a shift to more of a consumer-centric approach. And when you look at who is at the center of that journey, it is the consumer, whether it's a patient, an individual, a member of a health plan, et cetera. And that's going to be the primary catalyst to change, especially as individuals are empowered with more information and more personalized information in a timely manner to actually act upon that information through the delivery system. There are, other barriers. I saw, some commentary around rural health, which is another barrier. It just ties into access to care and accessibility. And so it's not an easy problem to solve. But the good news is there are a lot of smart people engaged to try to address it with the right intent in mind.
Okay, well, I guess that does step on the next question I was going to ask, because we talk about the empowerment, and we've talked about patients having this data at their fingertips about, whether it's their heart rate or any of these other metrics, and then bringing those in to the doctor, their next visit or scheduling a visit. But that connectivity piece and the access to good connectivity and internet was a part of that last question that I think Josh was looking at when he answered there. And, I've seen news about somebody on an athletic field, and their Fitbit is giving them readings that really gave them alarm, and they decided to go seek attention right away. And it was a good thing they did, because it helped save them. But I know I don't always know when I start seeing various symptoms, does this rise to the level? But with that connectivity piece, and there was a question in the chat about getting the data from the device to the provider. And I think that connectivity piece, just like the astronaut, someone who's able to react and maybe let you know, hey, you should come on in. That seems to be a big challenge. And so, what can we expect from the connectivity piece, and is that a big hurdle?
And I think connectivity, for sure. I mean, I think just across the spectrum, telco community, wireless connectivity, internet penetration. I mean, it continues to improve. So from that perspective, I would say connectivity for sure is going to continue to improve. The challenge from my perspective is more, how do we create dashboards and pre-analytics, AI-driven analytics, so that, somebody as in, whether it's a firm, whether it's a device, whether it's a consumer, a provider, how do we handle that oodles of data that's being generated in real time, right? If I walk into a physician's office and give him or her, my past 3 months of sleep data, if I print it out and take it to them or whatever, even if I send them a PDF, they're going to be overwhelmed, right? So the challenge, I think connectivity is absolutely being worked on. I mean, we're seeing 5G technologies, we're seeing 6G. Luckily, a lot of these are low latency, low bandwidth requiring, devices as yet. But we continue to see, telco connectivity improve. But the challenge is going to be around, again, more on the analytics. What do we do with that analytics? How does it embed into a clinical workflow? How is who gets the alert, and how do they get it, right? I mean, all these things are really important.
Well, you guys certainly gave us a lot of great insights today, a lot of food for thought, and really a lot of hope for where this could go. I mean, I know as a healthcare consumer, I'm pretty excited about the things you're talking about and the big opportunity, despite any of the challenges, right? It's a process. And so I thank you both, Rahul and Josh, for being with us today.
Thanks.
And I thank, of course, Deloitte for helping DHI bring this great event to everyone. And then finally, the audience for joining us, for interacting with us and giving us some great questions. Again, this event is on demand, so you'll be able to check back in, and maybe there's something you missed or something you just want to listen to again. So thank you again to everybody. This concludes today's event.
Thank you so much.
Bye.